Effectivement, on va s'intéresser à cette question en français et en anglais. Vous aurez une traduction simultanée dans les deux langues, de l'impact du réchauffement climatique.
You will have simultaneous translation. The subject is the impact of climate change on the vulnerable populations. The impact is considerable, be it in areas where the population has a low income or in other areas. There is one number among 15,000, and I think that our guests will list different situations and different numbers, but there's one figure which is very eloquent. A child born in a low-income country will face 3 times as many climate impact situations than in the past. And this is an illustration of the injustice of climate change and its impact, its exponential impact on populations that were already rendered vulnerable by various contexts. We're also going to talk about the vectors, vector-borne diseases. We're also going to talk about the impact on mental health, because here again there is an impact particularly for the vulnerable populations and the challenges that have to be taken care of by governments and health experts and agencies, and which today's militants and activists are talking about. We're going to have some brief presentations, keynotes of 5 or 10 minutes, and then a question and answer sessions in which we're going to talk specifically about these problems and about possible solutions. So now we'll invite you to take the floor. Please applaud the Mayor of Geneva, Mr. Alfonso Gomez. Thank you for the introduction. Now, climate change is obviously having an impact today, which is obvious, even though some people are still contesting it. Is having an obvious impact on human health, and this is obviously increasing the risks related to new pathogens, to pollution and to extreme meteorological phenomena. The heat wave that we had in 2015 in Switzerland caused 800 additional deaths than it would have done normally, than we would have had normally. But the risks caused by climate change are not distributed uniformly, of course. Now, in some social groups, we can see that these groups are much more vulnerable than others. Now, of course, there are some obvious facts. We know that elderly people and adults suffering from psychiatric problems and children and people already weakened by a disease are affected more by climate change, or by heat waves, and also by people who are discriminated against because of their identity or because they belong to a particular community, and because they might be subjected to a restriction of their rights and their access to social benefits might be restricted as a result of these extreme meteorological episodes. Now, for all these people, if they live in towns or cities, they are rendered even more vulnerable. Now, it's Geneva is the most densely populated city in Switzerland, and indeed it's one of the most densely populated cities in Europe. And in Geneva, the temperature differences between the downtown area, the city center, and the surrounding area, which has a lot of trees and parks, is between 7 and 8 degrees. We know that the vulnerability level of the population varies depending on their living standard. Now, the phenomena caused by heat waves affect most the very densely populated areas like the Paquis and Eaux Vives district in Champel, which is has a higher standard of living. There it has 30% tree canopy coverage, and in the La Jonction area it's the same thing. So the people who live in these districts are most impacted. Now, as regards the remedies that they have at their disposal, well, they don't have so many remedies because the surface areas of the dwellings and the insulation of these apartments, which are often older, and air conditioning, if it exists, or air cooling, and the possibility of escaping these heat islands by spending the weekend or their vacations in a fresher area away from the city. These possibilities are not the same for everybody, depending on which district of the city you live in. Now, how can a city like Geneva take action to attenuate the consequences of climate change for these populations, which are the most vulnerable, and therefore have a beneficial impact on the health of those populations? Since 2022, we've had an ambitious climate program in Geneva with three main prongs. I won't go into the details of each one, but the aim is to drastically reduce greenhouse gas emissions on our municipal territory. And we would like to achieve a 60% reduction in the heat which is generated by ourselves and also in the imported heat, and achieve carbon neutrality net zero by 2050. The second prong in our program is that whatever we do in the coming years, we will have an increase in heat in cities, in a city which will be at least 2%, 2% increase. And we hope it will not be more than that, because the consequences will be considerable. We obviously have to adapt to these climate changes, and we have a considerable investment plan. All our investments are aimed in this direction, almost all of them. So our aim is to limit the impact of climate change on the health of our population. This is one of the main thrusts of our strategy. So without going into too much detail, what will this mean to people in everyday life? We have put in place a heat wave plan since 2014. We started off with the most fragile sections of the population, the elderly. We're in regular touch with them. We go and see them, and we make sure that they have sufficient water and that they are drinking refreshments, and that plan was beefed up this year in order to cope with temperatures which we are expecting to be ever higher, particularly over longer and longer periods. We have 52 measures which have been defined. Some of them have been implemented or will be implemented in the coming weeks of 2024. We're also targeting new sections of the population. In the past, it was elderly people aged over 75 years. Now we are we're targeting anyone aged over 65 years. They can benefit from personalized monitoring and follow-up, as I said a moment ago. And it also includes free of charge services. For example, free of charge admission to all the municipal swimming pools in the morning. And we also have agreements with the cinemas so that they can also grant free of charge admission to these people, to two categories, in fact, pregnant women and people with disabilities, so that they can have access to these places where the temperature is much cooler. We're also taking priority actions to strengthen protection of children in crèche. That includes protection against the sun, ventilation and air cooling devices, and the staff are specifically trained in the right actions and gestures to adopt. And there's a whole series of recommendations as well to promote the use of games involving water in creche. The second example, or the second prong, is the reduction of these heat islands, as we call them. We want to reduce these hot areas, particularly hot areas. I've described them in some of the districts of Geneva, which are vulnerable to this. We have a park-to-park project. We have quite a lot of parks and gardens in Geneva. The idea is that you can walk or travel from park to park with fresh micro ACs, with shady areas, and with water spray devices in order to cool people off. And we are continuing with a massive planting of trees, and we are also removing asphalt wherever it's possible in order to reduce the number of these heat islands in the long term. The third prong of our program is to guarantee access to water in public spaces. For a long time, we turned our backs to Lake Geneva, but in future we are going to guarantee access to the lake's water. We're going to guarantee access to beaches along the lake, and we're also going to install new water fountains in the streets. Today we have 330 water distribution points which have been surveyed on our streets. We want to increase this ratio in order to be able to make it easier for the population to quench their thirst in hot periods. We're also paying attention to people who live in precarious situations, for example, people who suffer from reduced mobility, so as to make sure that they are able to have access to these areas of freshness, and also to make sure that children can have access to them. We also have paddling pools. We have a whole series of criteria to make sure that these paddling pools are kept in a clean state. This also requires continuous investment, and we're also continuing our investments in bathing areas. So we have a whole series of measures of this type, and that's the very responsibility of cities, in particular our city, because it's the citizens of our citizens that suffer most in times of heat waves, for the reasons that I've mentioned. So that's why we have to provide for the modification of certain areas of our cities. Then I would like to mention, in concluding, the limitation of personal individualized transport. Since 2016, we've got an alternate traffic system, and you can only use your car on certain days when there's smog if you have the necessary sticker between 6 a.m. and 10 p.m. And we also want to strengthen this system to make it even more rigorous during the heat waves, because, of course, internal combustion engines give off a lot of heat. These are just some examples, but they show you in very concrete, practical terms how a city can and must react to protect its population, in particular the most vulnerable sections of its population, from the impact of climate change. That is our responsibility. And in the coming years, we will be doing even more, because we are already behind schedule. So we will be investing considerable sums in this in the years to come. Thank you very much indeed, Mr. Mayor. We will be talking to you again in a little bit later, and ask you to react to some of the points we've heard. We are fortunate to have with us a representative with us from the mission of Peru. She's in charge of the topic health, I propose that we extend a very warm welcome to Mrs. Gervasi Diaz.
French will take me. I want to start off by saying thank you to Mr. Alfonso Gomez, Mayor of Geneva, and my fellow panelists that will follow me, Stephen Cornish from Médecins Sans Frontières, Judith Moore from the World Economic Forum, Matteo Consiglio from Swiss Youth for Climate, and address, of course, my esteemed ladies and gentlemen who have kindly come to this event. Climate change affects every facet of human life, and health is no exception. Indeed, the Intergovernmental Panel on Climate Change, the IPCC, its 6th report concluded that climate risks are appearing faster and becoming more severe than previously anticipated, with 3.6 billion people already living in areas highly susceptible to climate change, such as my own country, Peru. We're aware that climate change is impacting health in various ways, including extreme weather events, the disruption of food systems, and increases in zoonosis and food, water, and vector-borne diseases. Furthermore, climate change is undermining many of the social determinants for good health, such as healthy and enriched livelihoods, equality, access to health care, and social support structures. More concrete examples include El Niño phenomenon, which is closely associated to a dramatic increase in issues such as diarrhea in the capital of Peru, which is Lima, and the recent dengue outbreak. Outbreaks such as dengue or other vector-borne illnesses can quite easily overflow the installed capacity of the public health system in developing countries, particularly in densely populated areas that are immediately outside the urban centers, so the peri-urban centers in countries. For developing countries such as my own, climate change represents an enormous threat to the health sector, as well as other facets of human life by reducing the availability of food and worsening household economies, for example. It remains to be seen how and to what extent countries and the global community can address many of the climate-sensitive health risks, particularly in terms of development, of global health and poverty reduction, and health inequalities between and within countries. It's in this spirit and facing this threat that the Kingdom of the Netherlands and Peru, together with 15 countries, decided to present a resolution on climate change and health for consideration for adoption in this year's World Health Assembly, which is taking place during these dates. And that resolution seeks to make health systems more resilient to climate change and reduce their own impact on the environment. The resolution that we're presenting calls for the development of a global action plan on climate change and health, and it asks the WHO and member states to collaborate with, as appropriate and to the extent of their abilities, with the Alliance for Transformative Action on Climate and Health, the ATTACH initiative, and seek to address gender inequalities in the impacts of climate change, and as well as in the development of future climate actions. We are confident that this resolution will be adopted by the World Health Assembly, and we look forward to having this resolution raise awareness on the critical need to bridge climate change and health communities on an international and multilateral scale, and we really count on your collaboration in this sense. Muchas gracias.
Merci beaucoup. Et on se réjouit.
Thank you very much. We're going to talk all about that in the second part. Now we're going to welcome a young activist from Jeunesse Suisse pour le Climat. And his name is Matteo Consiglio. Please give him a round of applause as well.
Fellow youth, excellencies, distinguished guests, ladies and gentlemen, good evening. It is an honor for me to be here today, representing Swiss Youth for Climate, and a privilege to be sharing the panel with these incredible and inspiring individuals. I would like also to quickly express my gratitude to the organization, not only for inviting us, but for meaningfully engage with us and treat us as equals, something that sadly is often not common when engaging with youth, leading to youth tokenization. The UNDRR says that there is no such thing as a natural disaster, only natural hazards, exposure, and vulnerabilities. Today, I would like to say that there is no such thing as a natural injustice, only hazardous situations exacerbated by exposure and vulnerability. When we talk about the effects of climate change in the health sector, we need to talk about inequalities, and because mitigating the impact of climate change requires equitable solutions. This is why we cannot consider only the direct effectiveness of our solutions. We need to consider how our current system works and how solutions are being generated, because the best lobbyist is not the one that censors unwanted solutions, but the one that promotes palliative ones. And so, in other words, we need climate justice. Many aspects have been discussed today and will be discussed in this panel. Us, as the Swiss youth, decided to bring to you experts in this room two particular topics: the power of knowledge and the power of youth, clearly. So, looking at the first one, we are particularly interested about two aspects. The first one is the importance of access to data and knowledge, because as we all know, data will increasingly play an important role in the climate crisis and in fighting it, particularly within the climate sector. According to the World Food Program, by 2050, the risk for hunger and malnutrition will increase by 20% due to the climate crisis. And in this context, AI and big data that will play a ever-increasing role. But we must ensure that this will not lead to more precarious work conditions for the most vulnerable people, particularly in the field, due to the increased reliance on technologies and data, primarily from the global north. And overall, so we need to think about the power dynamics created by our solutions. And then the second point is related to how knowledge is created. We must recognize the importance of participatory approaches when developing health-related procedures and knowledge, especially when it comes from the most vulnerable, such as indigenous people, women, and girls. And this for me really important, and that the prejudice that traditional and local knowledge is useless because it's not being generated through a scientific process is disempowering and can have severe health and non-health related consequences. Moving to the second topic, let's talk about the power of youth. A person I deeply respect once said that when we say that youth is our hope, we are admitting our defeat. And I couldn't agree more. Youth is important, is an important part of the solution, but everyone has his or hers or their role to play. We must remember that young people are the least represented age group, while in particular in vulnerable contexts are often the majority of the population, and this should concern us. And so, going to directly talk about youth and power, we need to know that youth is already doing a lot to empower itself, from COP to the streets of São Paulo, influencing policies, raising awareness, among other things. And people is asking the youth to provide more solutions, but then often these solutions remain unheard. So for sure, as a first practical step could be to actually start listening. In conclusion, I understand that as professionals of the fields represented here, your time and resources are limited, and I understand that increasing the angles into projects such as youth or vulnerable groups increase the complexity, and in particular if projects are already ongoing can create financing problems with donors. But by taking the necessary steps, we not only address the intimate relationship between climate and the health, but we build a more just and equitable future. We owe this to the most vulnerable ones, because, as we know, they are those who contributed the less and are affected the most by the climate crisis, and we owe it to the people we love and the future generations. For them, we must carry the torch forward. Thank you.
Merci beaucoup, Matteo.
Thank you very much indeed, Matteo. We will also be hearing from you in the second part of the panel. Now, there's our next speaker is someone who knows more than anyone else how important these vulnerabilities are. And he is someone who is helping to contribute to resilience. Our next speaker is Stephen Cornish, General Director of Médecins Sans Frontières, Switzerland.
In this debate. And I'd like to start with a quote from one of my colleagues in the field that we work with in Mozambique. And he says that for those who are still wondering what climate change looks like, they should come here to Mozambique, because we are bearing the brunt of the actions caused by the world's most polluting countries. We now have malaria peaks year-round and are struck by cyclone after devastating cyclone. My colleague Adamo has said these words, but sadly he's describing the reality that we now face in many situations. And around the world, over and over, we're now seeing our patients, community members, and other responders wondering how they continue to cope, how they can continue to cope in front of multiple shocks. No faster do they have one shock that they have another one and another one behind, and I'll speak more of that vulnerability. My organization, Médecins Sans Frontières, we work with these communities and we see these effects that are affecting them today. This is not some far-off threat, but is now part of their daily reality. And the climate crisis is hitting those people, and we can see it, and we see them increasingly in our waiting rooms. From Niger to Mozambique, from Honduras to Bangladesh, we're treating increasing numbers of infectious diseases like malaria and dengue, treating more malnutrition, chronic malnutrition, and increasingly seeing weather shocks and climatic events striking these same communities. Over the past year, we've responded to widespread flooding in places like South Sudan and Kenya. And these floods they don't just come and then go. They waterlog the ground, so much so that once it comes time for planting season, people can't even plant. And as soon as one issue finishes, we see the rise of another, from a cyclone to drought to the increasing difficulties that it causes in relation to malnutrition. We've also responded to concurrent cholera outbreaks in many locations. We have not seen such rates of cholera in many, many years. We're facing a shortage of vaccines and a shortage of memory on how to treat cholera, so we have increasing mortality rates in many places where they used to be more adept at managing, and will have to learn again how to manage increasing numbers of cholera patients on their wards. In Chad last year, for an example of how this kind of cycle happens, we had an unprecedented drought. It had been 3 years already of lower rainfall. This led, of course, to loss of livestock and to a much longer hunger gap period than normal. No sooner did that subside that we had flash flooding. The rivers rose by over 8 meters, creating about 500,000 people who ended up being displaced. Those people were then subject to measles. And then when it was normally time that the flooding would go down, just like in South Sudan, the flooding didn't subside and people couldn't go home to their areas, and as a result also missed a planting cycle. And now we're already into the next series. And so when you're struck over and over and over again, the resiliency that communities have, they are the first line of defense, but that resiliency starts to get eroded. And we need to start looking at how we can work in partnership, how we can collectively build and strengthen that resiliency so that they will be able to continue being the front line of defense, front of the climate shocks to come. In fact, we believe so strongly in community-based approaches, and I think we all saw that collectively in this room in looking at the responses to the COVID-19 pandemic. We saw that areas that had resilient health systems and community-centered approaches had more trust and did much better at responding than those who had a lower trust ratio and those who were more centralized and with less community involvement. And so building on that, we've moved towards a patients and populations as partners approach, where we build them into the core of the programming. And until now, we've had a bit of a fire brigade or ambulance, if you like, way of bringing about this as sort of we know best and how to approach things. But we're turning this on its head to really try to understand and co-create with the communities themselves according to their needs. In Honduras, in responding to dengue, we're trying to come up with something else that we can put in the toolkit. And many of you have heard about the progress of Wolbachia, but it's a very expensive procedure. It's not been done at community level and at scale in a way that would be sustainable. There's still fear and those who are wondering about the consequences of using a mosquito that can't transmit dengue. And so we've, together with the community there, interviewed over 10,000 community members in Tegucigalpa. We've brought the community into looking at the design of the pilot, into how we implement the project, into every different aspect of the activities, and worked alongside also with the Ministry of Health, the local community, and are hoping that this might give us a new tool in our tool belt for responding in other areas. In Mozambique, we're trying an approach also there with community health workers, with the Ministry of Health, and we're looking at how we can treat the rise in non-transmissible diseases such as schistosomiasis and filariasis, who we also see are increasing with the climate changes and with the various climatic shocks. So there we've also co-created and co-designed activities. We've strengthened together with the water community and brought 350 households well water, as well as outfitted the health system itself so that it will be more resilient in front of future shocks, and are hopefully even going to look at natural predation that might be able to lower the amount of snails that transmit the schisto, trying to find other ways, not only medical ways, so that the communities will actually have the means, the capacity, and the knowledge to be able to help reduce the impacts of the augmenting toll that these diseases are having on their communities. And I've spoken already, and Matteo spoke about the resiliency of communities and the importance of communities and that partnership. We truly believe in this, but what we are seeing is these communities are increasingly being very challenged. And on our part, frankly, as a world community, we've not met our responsibilities. It wasn't very long ago that the historical emitters, the northern nations largely, accepted full responsibility for the climate crisis that we're coming into and undertook to support with adaptation and mitigation, with technology transfer, with fund transfer. This we are not seeing at the scale and the speed that we need. In fact, we're seeing so much foot dragging that we are now, in many cases, not moving beyond adaptation and mitigation because it'll continue to be necessary, but we're in the midst of so many concurrent disasters in real time that it's high time the Loss and Damage Fund gets up, running, and fully funded. And unfortunately, across the bar, we're still arguing about whose responsibility, whose share, and really foot-dragging when it comes to the COP climate talks, and that's something that really has to stop. So it's not only what we're trialing in the fields, but it's also what we have to do on our side, and we believe that that advocacy is just as important as the pilot projects that we're running in many of these cities. But it can't just be humanitarians and health actors and development actors and local governments. It's going to need, and we heard this from AXA, also new innovations, new business, new financing, many different models that are going to have to come together at the same time. And we'll have to find ways to scale the pilots that are bringing the most innovative results. We're very fortunate at MSF to be trialing a partnership with one of the past AXA winners, with Health and Harmony, who've developed a model where you help restore the natural environment, you help build livelihoods, and you work on health of the local community, and do so through an approach of truly radical listening and building the different pieces of the project in line with the community's desires, not in line with what's most important from a health perspective or what each actor would like to do, but really how and what the community thinks are the right way to implement the solutions and also in the right sequence. And we're trialing this project in Madagascar, which we have seen not only has longer hunger gap periods, extreme droughts, but multiple cyclones hitting one after the other. And if you rebuild your house once or twice in a season, imagine if you have to go through and try and do that again. And so together with New Tanitsika, which is a local organization that works on livelihoods, a Malagasy organization, Health and Harmony and MSF, we're trialing this, and I would hope that I'll be able to come back in a couple of years and tell you some amazing results. But what we're doing so far are pilots. They're interesting, they're important in order to give us a new set of toolkits for tomorrow. But we truly need to see the financing, the partnerships, to be able to bring these things to scale. We need a real sense of urgency that we frankly don't see if we're going to truly strengthen communities' capacity, resiliency, have people at the center, and to be able to boost the most vulnerable communities around the world to the degree where they'll be able to stand up for themselves with help front of the climate crisis to come. Thank you.
Merci beaucoup, Monsieur le Directeur. Vous pouvez rester, Directeur.
Thank you very much indeed, Director. You can stay on the stage. I'm going to ask our other panelists to come onto the stage. We have divided this panel discussion into 4 different topics. The first topic is inequalities, which is of course related to the topic of vulnerabilities. And I suggest that we broach this topic by looking at a first video together.
Peut-être.
Perhaps.
climate change is already making poverty worse.
بنعالج حالنا بحالنا ما حدا بيقربنا.
The World Bank says it could push 130 million people into poverty in the next 10 years.
The richest half of the world are responsible for 86% of greenhouse gas emissions, and the poorest half for just 14%. But poorer communities are already worse affected by the climate change caused by those emissions, in many ways that aren't that obvious.
Like extreme heat.
Everything is exposed. The sun is beating down directly on you, and it's just unbearable.
During the June heatwave in the United States, scientists found that streets in poor areas were up to 3 to 10 degrees Celsius hotter.
And many people take medication here, and they can't sustain themselves outside for any length of time.
And that's because of too much asphalt, concrete, and the lack of trees.
Trees are life. The role they play in our ecosystem can't be overstated.
Yvonne Aki-Sawyer is the mayor of Freetown in Sierra Leone and has plans to plant 1 million trees in the city. Trees create shade and plants pull moisture up from the ground, which has a cooling effect. Research suggests that people in areas with less vegetation have a 5% higher chance of dying of heat-related causes. It's holding whole countries back. Scientists at Stanford University estimated that Nigeria's economy is 29% smaller than it would be without climate change. Brazil's is 25% and India's 31%.
J'aimerais entendre vos...
So I would now like to hear your reactions to this video with a particular angle. From the point of view of public policies, which should be aimed at preserving these sections of the population as much as possible because they've already been rendered vulnerable. Now, I'm going to be a bit provocative. If these sections of the population have been rendered vulnerable, it's because the politicians and policies have failed. So the question is, how in future can politicians protect better these populations? Stephen Cornish, you have a role of advocacy. How are you aiming to protect your the populations better? Answer. Now, our approach is to ask the countries that have generated these emissions to bear their responsibility. They've already admitted this, but they are taking time, quite a bit of time, to deliver. We are living in countries in which we have that capacity and ability, but for several reasons, we have difficulty in conducting our response. Now, in very vulnerable countries already, often they don't have much access to health, and there's also vulnerability in terms of their livelihoods, because they have to face up to a number of different scourges and climate impact altogether. So it's not going to be easy. Moderator, bearing their responsibility, does it mean paying or something else? Answer. It's not just paying. There are other means of responding which have been discussed. Debt reduction, technology transfer. If we take a look at the COVID crisis, for example, we have all signed laws together in the context of the World Trade Organization, World Trade Organization, not World Health Organization, World Trade Organization, which states that during pandemics we will put aside intellectual property, and we will look at what we were doing previously. But what we do, we privileged ourselves for delivery of vaccines, and we charged them, other countries, developing countries, more for vaccines than we paid ourselves. We took a long time to deliver them. We have to ask ourselves some questions about this. So often we don't respect the general standards for other people as we do for ourselves. Mr. Gomez, what about these vulnerable populations? Do you agree that if populations are vulnerable, the city or town has failed to a certain extent to protect them? And how can cities do more to protect their populations from climate change? Mr. Gomez. Well, some things have really happened in recent years, and that is that climate change has become much more tangible. Now, 20 years ago, some people were talking about climate change, but now today, almost everyone recognizes and acknowledges climate change. That has become an acknowledged and fact that we're aware of, that people are being sensitized to. Now, as regards the second stage, in order to cope with these new paradigms, a redistribution is necessary. It is necessary today that public authorities at the local level and at the global level, what we need is a redistribution of investments. As I said in my presentation, in the well-off districts, there is tree cover, canopy tree cover, but in the much more densely populated districts of cities where incomes are much lower, that's not the case. So we do have this responsibility, but it's a common shared responsibility. We have to be aware that the investments that are necessary to reshape our towns and cities will be substantial. We have redesigned our cities to take account of objects like cars and motorized traffic and individual well-being. But in future, we will have to take into account consumption. Now, recently, we were wondering how climate change could influence purchases of clothes. Now, in fact, consumption of clothes has doubled. In Switzerland, people buy and consume 25 kilograms of clothes a year in Switzerland. We don't always use them. Sometimes we send them back. This is production. This involves production of CO2. And obviously, these clothes are produced in the global south and generate a lot of CO2. And then often the clothes have to be sent back to these countries in the global south. This paradigm has to change. Matteo Concilio, you are the youngest member of our panel, despite the fact that you're wearing a tie. You're 26 years old. Statistically, you have a greater chance of dying of climate change than we do, and a greater chance of suffering in your body from climate change than the other panelists here. It's a form of injustice. And if you were a member of a vulnerable section of the population, then the risk would be increased even more. Now I'm being provocative. What do you call upon governments today to do?
Speak in English, but yes, I think that on the one hand, there is the fundamental injustice of it, of course, as you mentioned. As well, the fact that we did not contribute, but we are in it. This being said, I think that the risk of kind of doom and gloom to just give up is really strong. So here I would go to kind of my first point, which is that one of the role of the youth is to show to the rest of the of young people that change is possible. It's not easy. It's, I would say, 90% frustrations, but still, 95 maybe. But I think that we need to make our voice heard, not only because it's fair, but it's because this is going to be our word. And one day we will not be the youth anymore, and if we don't do anything, we will just be even worse because we had the knowledge. So I think that in terms of action, of course, I think nobody deeply questions the fact that in terms of expertise, many of experts with 40 or 50 years of experience have a greater say for certain or most issues. But I think that there are two important points to consider when we talk about the public policies. The first one is that I recently met, I studied at Geneva Graduate Institute, so just around the corner, and a high-level UN figure came for a small meeting, and we ended up talking about climate change and youth. And I think he perfectly summarized the point of why youth is important, is because I noticed that, of course, the more people acquire agency, the more there are strings, being them shareholders, being them budget, being whatever thing. And the youth is there to say what many people, being as expert and living that context every day, know really well. They know it. But it's understandable. I'm not going to be the one that would just condemn it without. But to be the ones who say what everyone knows but doesn't want to say, and in the process, even if probably in that specific time you will not change anything, and it will probably either be met with just ignoring it or with superficial acknowledgement, it still becomes a statement, even if it's not an explicit one. So.
Très bien. Vanessa Aliaga, vous êtes le...
Vanessa, you are a representative of a public authority, indeed of a state which is a victim, and a state which has to protect some of its population, part of its population. What are you doing to protect the most vulnerable people and to reduce inequalities in the face of climate change and in the face of the risks that are related to climate change?
It's a tough question. It's a tough question because a lot of what can be accomplished cannot be accomplished by Peru alone. So when one thinks about what can governments do to address climate change, address the impacts of climate change, especially on the health or especially on the lifestyles of the most vulnerable, you can think about mitigation or you can think about adaptation, generally speaking. There's not so much that a country like Peru can do in terms of mitigation. We contribute, certainly, not a great deal, but we do. However, we don't necessarily have the technology, the know-how on how to do a paradigm shift to something, a consumption model or a production model that would be more sustainable. So we would need international collaboration and cooperation to really perfect and accelerate that transition, on the one hand. On the other hand, in terms of adaptation, which is where we focus most of our efforts because it's what we can control, or can control more easily by ourselves, there's a lot of efforts pouring into protecting and preserving the well-being of our indigenous communities in Los Andes or in the Amazon. Also, these communities have been facing disproportionately the impact of climate change for so long at this point that they have developed a good amount of strategies and know-how and they have developed systems that we should look into and try and learn from and replicate to the amount possible in other areas. So it's not just let's help them, but let's learn together what has been working for them and try and help them strengthen and expand the skills and the strategies that they have already developed. Of course, we need to continue to make sure that we protect their rights to a clean and sustainable, healthy environment, their rights to safe drinking water, their rights to adequate housing, and of course their rights to access to health services. There are programs at the local, regional, and national level for this type of thing. Of course, we always need to think about this on an international level, because it is an international issue. It will affect all of us sooner or later, and countries like Peru are paying the price sooner than, but eventually we all will. Everyone will be affected by this, and so I think there needs to be more foresight on the side of the main contributors to climate change, to realize that this is something that's going to come to their front door soon. And in that sense, I think the key is solidarity. We're suffering it right now, but you will suffer it soon. And in that sense, we should all get together and think about a just transition to more sustainable living, and try and overcome a lot of the economic interests that are in between, that are holding us back right now.
Vous avez cité des populations.
You mentioned some specifically designated populations, the indigenous populations who live in the Andes or in Amazonia. These are populations who are already vulnerable. Okay, but is it only populations which are vulnerable because of their geographic area, or have you identified in your big cities sections of the population which who are vulnerable to climate change, and what is their common denominator? Could you give me some common denominators of among who is vulnerable to climate change and who you have to protect more?
I think the key, the common denominator is poverty. People, they say no, the people with disabilities are disproportionately affected because when high rains come or when extreme weather comes, they have problems in or challenges in accessing buildings, in accessing in rural areas of Peru, most certainly. So yes, people with disabilities, children, the body is developing, so they are particularly vulnerable. Yes, but all of this is worse when you're talking about people with disability that are also poor, children that are also poor, women that are poor, ethnic and religious minorities that are poor. And I think the key is poverty more than other forms of vulnerability, of situations of vulnerability. And so even in Lima, where we have the best systems, medical systems, and the best services and the best facilities for people with disabilities and children, and et cetera, et cetera, et cetera. Even in Lima, sectors C, D, and E of our economic scale are facing enormous challenges. And I think that is kind of a little micro representation of what's happening worldwide, right? People in the most developed countries are, doing relatively fine, and then people in the most impoverished countries are facing the greater challenges, and it's the same on a national scale, right? The people that are doing better off in sectors A and B in Peru and in Lima are doing relatively fine. Climate change has not really affected your life because you have air conditioning and you have a pool and you have, so you're fine. You don't see it, and that's what continues to allow for the economic and consumption models to remain the same, right? Because people in charge are still doing relatively fine. And I think that's going back to the idea of solidarity, right? Eventually, we'll all be in the same boat. And yeah, it's like the Titanic. You know the movie Titanic? And the classes A's and B's were, the boat was sinking. They were all going to die. But classes A and B were, there was a violinist. Yeah. And I think that's where we are. We're the violinists, and the boat is sinking. But eventually, we're all going to die. Yeah.
Merci pour la métaphore. Alfonso.
Thank you for your metaphor. Alfonso Gomez. Recently, you said that the LGBT plus group was a group which was going to suffer much more from climate change. Is that something intuitive or not? Answer, yes, I think it is something intuitive. What is the link between being homosexual and, because of that, suffering more from climate change? But what's just been said on this panel sheds a lot of light on this. The first layer is the precarious situation. Once you're in a precarious situation, then, of course, you are in danger. And then within the context of precariousness, you have minorities, whether they're recognized or not, whether they are being cared for or not, who sooner or later will find themselves in situations which are even more difficult than those faced by others who are in a precarious situation. That's what we wanted to stress. Let me give you an example. We know that in some countries, some other countries, but also here in Switzerland, in the medical world, there's still not a very good understanding of LGBTQ plus climate change, which is greatly affecting this population. Precarious people affects precarious people among the precarious people even more. And of course, it's always difficult for people who are in a state of precariousness to help others in the same state. There's still some pockets within this context who are more sensitive, and we have to remain attentive to them. We're now going to move on to the second section of our panel discussions, and we will first see a video by way of introduction.
New research has found that the mosquito problem could get a lot worse due to climate change. The result paints a bleak picture, highlighting the potential for serious public health consequences. Scientists at the Los Alamos National Laboratory has investigated how climate change might impact the spread of mosquitoes. They say that they found that mosquito-borne diseases will be continued as a threat as the climate warms. Put simply, as global temperatures rise, mosquitoes may find new territories to thrive in, and that translates to more people facing the risk of serious mosquito-borne illnesses. Now, climate change is reshaping the world's ecosystems, and mosquitoes are adapting swiftly. Scientists used computer models to predict how 9 mosquito species respond to rising temperatures. The findings reveal that 6 species expand their geographical ranges to shift their ranges, moving to new areas due to changing climate conditions, and 1 remain nearly the same. However, even for this species, the areas currently suitable for its survival are projected to become more favorable in the future. Warmer temperatures accelerate the mosquito life cycle, resulting in the faster breeding and larger populations. Higher temperatures reduce the time required for mosquitoes to develop from eggs to adults, leading to more generations of mosquitoes in a single season. Ultimately, the combination of faster breeding, larger populations, and longer active seasons heightens the risk of mosquito-borne illnesses. Now, these changes could mean exposing new populations to diseases they have not encountered before. The public health experts warn that communities need proactive strategies to handle this emerging threat. These include increased surveillance, vaccination problems, and public education, which is crucial to managing the risks.
Les conséquences, c'est la thématique.
I would like to deal with the consequences of climate change on health. They are unforeseeable. Now, Stephen Cornish, how are you going to adapt the action of MSF to respond to global health problems, some of which may be foreseeable?
Change how we work, and we are doing so as we speak. We hire more community health workers. We train them in how to identify the early signs of malnutrition, of malaria, give them the means so that we're not waiting until after. We know when the malaria peaks will come using both satellite imagery, weather forecasting, etc., and we do mass drug administrations ahead of the peak. So, but these are things that are at this stage just holding up, because what we don't know is how each of the different overreaches are going to react together. And the best mapping that we have and the predictions that the scientists are giving us on climatic changes and on the efforts and the effects it's going to have on nutrition here or on health here, they're not linked together. So we have no understanding, for example, of what will entail massive levels of deforestation, of species loss, on top of ocean acidification and overfishing. How much will that impact the amount of protein that people have to eat in the Asian region? And what arboviruses are going to rise and how fast? And what will be our ability to combat that in an effective way? These things are not known. And so it's why I said earlier that the pace that we're advancing at here is in no way taking into consideration the actual challenge that we're facing. We need like a whole of world, a whole of system approach, ratcheted up as if this was the World War IV, and that's not what we're seeing. So what we're seeing is individual efforts in different places. Even when it comes to such things, you were speaking about the importance of canopy cover, and we know that that can change the temperature underneath by 10 to 15 degrees. We have no understanding of whether the canopy cover that we are now planting or protecting will be able to survive the climatic changes in the different areas of the world. We won't know that until 40 years from now. So we have to try many things all at the same time. We don't know the success ratio of what we're trying. We don't know how the various threats actually map out and affect each other. And we're not going anywhere at the speed of investment, trial and error, learning, and collective partnership, and a whole of society and government approach, including business. And it was good to hear we are still pumping out and extractivizing at such a rate. In many countries, most countries, we have populations that are more vulnerable and areas that we have sacrificed, either to extraction or to industrialization. We are not making the progress on those areas, much less doing enough to tackle the real threats that we face.
L'exemple du moustique, c'est une maladie.
The example of the mosquito is a disease that we already know, but the area it affects has been enlarged by climate change. But there are other diseases, these so-called vectorial diseases, which we are expecting to increase considerably. Is that one of the main risks that one of the main risks of climate change that you are analyzing today? Answer.
We take very seriously and are looking at and conducting research with other organizations, with universities, on coming up with new tools and new responses. And it's not only if it's a new disease. If a disease is present in a new area, people don't have the antibodies and the history of responding to it. And we know from the research that dengue is and will continue to spread into new areas in Africa and in Asia. We know that malaria and other mosquito-borne diseases are going to be brought up into the North Americas and probably into the southern parts of Europe. And so the challenge there is something that we're responding to individually, but I mean, I wouldn't like to leave the impression that we are doing so much that it's going to be so earth-shattering changing. We have another difficulty, and this is that right now so many of our responses are so heavily medicalized or relying on vaccines. I mean, we're also thrilled with the new malaria vaccines. Those are 4-shot vaccines that we are trialing because they could hold some promise. But a 4-shot vaccine that has to be repeated infinitely, we have already, in some areas, 40 to 60 vaccines, and there's not enough money to cover it. ODA and humanitarian funding are dropping as we speak, dropping like to the rocket bottom. We've never seen as much displacement, the rise in cholera and so many other things. You know, through the 90s, we had this period where displacement, conflict, nutrition, malnutrition, all these things were going down. They're all coming back up. They're all going to be accentuated and exacerbated by, and it's like we're taking a holiday at the same time, collectively. And that just simply can't continue.
Monsieur le maire, vous vivez dans un pays...
Mr. Mayor, yes, I think you can applaud.
Alfonso Gomez, vous vivez dans un...
Alfonso Gomez, you live in a country which has been condemned by the European Court of Human Rights because it does not take sufficient account of the elderly section of the population with regard to climate change, or at least climate change because of the care it receives or doesn't receive has a greater impact. Have you identified a specific danger for the population of your citizens in Geneva as a result of climate change? Well, this case was taken to the European Court of Human Rights, and the verdict was that despite the fact that Switzerland has laws against climate change, it's not done very much. And they said, we're going to sentence you already now because you've not taken any measures. But it's we're talking about the health of the elderly, yes. Obviously, the weakest section of the population in terms of health when it comes to climate change is the elderly. Everyone knows the Swiss pension system, which takes account of the fact that there is a considerable change in income once one retires, and therefore this is a section of the population that finds itself rendered precarious in Switzerland quite easily, quite quickly. We have observed this, and as I mentioned earlier, since 2014 we have found that it's the elderly section of the population that suffers most from heat in Switzerland. Now, a few years ago, I think it was about 3 years ago, we launched a campaign with Extinction Rebellion and using posters saying, look, this is what's going to happen in 2030 or 2035 if we do nothing. And there was one poster which said there's going to be an invasion of tiger mosquitoes. So we did take a lead, and specifically this means that municipalities are in the process of drawing up plans because things which did not exist in Switzerland, could not be found in Switzerland a few years ago, like tiger mosquitoes, will be found in the coming months and years. We almost certainly will suffer such an invasion. We have the same problem with ticks, which come from the south of Europe and are moving north due to climate change and global warming. And the population of these creatures is increasing. But once again, children are rendered vulnerable, but the first to suffer are the elderly. You've talked to us about the populations. Now, what are the consequences in terms of health for the populations you referred to? And how does the impact of climate change materialize itself on these populations in Peru?
So I think a good example is dengue for Peru. Dengue is endemic in Peru. Year after year, we have dengue outbreaks, typically in the northern part of the country, northern, that is the most tropical, traditionally. But for example, this year, from January to March, we lost 40 Peruvians, and not just in the top part of the country, but throughout the coast. So the geographic spread was enormous. And we lost 40 Peruvians in the first trimester of 2024. And in 2023, throughout the whole year, we lost 20 Peruvians. So this is a huge increase. I mean, the effects are immediate and they're mortal in a lot of cases for us. And that's just dengue. But there's other diseases that are being worsened by climate change. For example, polio had been eradicated in Peru. I forget what year, but I think it was in the 80s. And because of melting ice caps that came down the river into the Amazon, a new strain of polio was detected in a local community in the Amazon that is nomadic. The community is nomadic, so it travels through Brazil, Colombia, Ecuador, and then comes back to Peru. So this is incredibly problematic, not just for Peru, but for our neighboring countries as well, and not to mention the community itself, obviously, because polio, the vaccine, is, I think, 2 doses or 3 doses. I'm not a specialist, but it's several doses, and the community is very distrustful, especially after COVID, where so many brigades were coming in and trying to vaccinate. So they're very wary, very difficult to get them to trust the people who are vaccinating. And it also hurts, I understand. So the moment it hurts, they never want to come back. But it's 2 doses. And so this is also problematic. But these are just some examples of how climate change is affecting vulnerable communities. And for example, in the dengue case, we are trying in adaptation measures, right? So we do, the Ministry of Health does trainings on proper water care. Because another problem with dengue, it isn't just the rising temperatures, it's the lack of water, like running water, like tap water, that infrastructure for impoverished areas. So they have to collect water. The water truck comes, they collect water in big buckets, and then they leave their water in the buckets with the high temperatures, and it's a perfect breeding ground for all sorts of diseases, really, but dengue also. And so we teach, the trainings teach local communities about proper water care, how to cover it, with what materials, how to disinfect it, and the early symptoms of dengue, so that if they start feeling ill, they go immediately to the doctor and not, any alternative medicine. We try to invest in getting water systems to these communities and buying adequate medical equipment for the local medical posts or clinics, the nearest ones. And then, of course, vaccine buying. But all of these require money, require time, require organization, and this is difficult for the public sector. So sometimes we fall short.
Il y a une conséquence que vous avez pas.
Now, one consequence which you did not mention, and that will be the topic of our third section, is mental health. Matteo Concilio, young people are particularly concerned by this topic. So I suggest that we all take a look at this video, and then I will ask you for your reactions.
For all that's ever been said about climate change, we haven't heard nearly enough about the psychological impacts of living in a warming world. If you've heard the grim climate research that science communicators like me weave into our books and documentaries, you've probably felt bouts of fear, fatalism, or hopelessness. If you've been impacted by climate disaster, these feelings can set in much deeper, leading to shock, trauma, strained relationships, substance abuse, and the loss of personal identity and control. Vital political and technological work is underway to moderate our climate chaos, but I'm here to evoke a feeling in you for why we also need our actions and policies to reflect an understanding of how our changing environments threaten our mental, social, and spiritual well-being. The anxiety, grief, and depression of climate scientists and activists have been reported on for years. Trends are seen after extreme weather events like Hurricane Sandy or Katrina for increased PTSD and suicidality. And there are rich mental health data from northern communities where warming is the fastest, like the Inuit and Labrador, who face existential distress as they witness the ice, a big part of their identity, vanishing before their eyes. Now, if that weren't enough, the American Psychological Association says that our psychological responses to climate change, like conflict avoidance, helplessness, and resignation, are growing. This means that our conscious and unconscious mental processes are holding us back from identifying the causes of the problem for what they are, working on solutions, and fostering our own psychological resilience. But we need all those things to take on what we've created. Lately, I've been studying a phenomenon that's just one example of the emotional hardships that we're seeing. And it comes in the form of a question that a significant amount of people in my generation are struggling to answer. That being, should I have a child in the age of climate change? After all, any child born today will have to live in a world where hurricanes...
C'est qu'un extrait, hein?
It's only an excerpt, but Matteo, I would like to hear your reaction, because she was talking about her generation, which is more or less the same as your generation. How can we do more to protect the mental health of...
The video was really, really good. I think that I would just do a little premise before actually speaking what in the end is eco-anxiety, has different names, but I think that it's important to highlight, because maybe here that we primarily have health experts, this is not the case, but aside of here, this sort of anxiety is often perceived just as this oversensitive generation who always has to invent something new to complain about, which you being health experts, you probably know better than me the consequences of having a psychological struggle and being constantly delegitimized. So what I want to first say is that I think that often fairly enough, because here we are in a place like Geneva, when we talk about eco-anxiety, we think about activists, scientists, but we are talking about the inability of people to predict a ever more unpredictable future, and where the individual agency shrinks, if not in collective manner. So, in my opinion, even the economic insecurity of the farmer who has its knowledge to manage that land that probably in a good part will be obsolete, and then leads to mental health problems and even suicide. This is also eco-anxiety. On how to cope with it, I think that the first thing is always to contextualize it within the... And actually I was speaking with a friend of mine recently about this, and I loved his answer, because his answer to how to solve climate anxiety is implement climate policies. That would be a good start. But aside from this, yes, of course, always remembering that while the individual's mental health is crucial, we're talking about a symptom of a broader systematic problem and not the cause. And in this context, I think, of course, the mainstreaming of mental health and mental health practices, which are in the end at the core of this. And if I think about young people in particular, seeing other young people who show through their actions and their word that you're not the only one who feels this. Doom is not the only alternative. We can do something about it, not alone, but we can be together and try to do something, and this helps a bit.
Stephen Cornish, j'aimerais vous entendre. Comment est-ce que...
Mr. Cornish, does MSF take an interest in mental health in the face of climate change, and how do you envisage taking care of this problem?
MSF mental health activities are interwoven into all of our responses. Whether it's a natural disaster or a hurricane, whether it's a conflict or displacement, once communities become vulnerable, then also, just what we heard on the film, these things start to come about when you have feelings of hopelessness, of loss, of lack of agency, etc. And we've seen by doing group therapy, by doing psychological first aid, having psychosocial activities with children, we can reduce the likelihood of PTSD, and we can help communities strengthen that resiliency that they already have. What we know, and not only from our own work, but also from that of the Fridays for Future movement and Greta Thunberg, is that one of the best ways around having this kind of a climate grief or this sense of desperation is to have a sense of community, to have a sense of action and purpose, and to have partners and others walking along the road with you. All of these things translate into hope. And hope for a brighter future is what allows all of us to get up and to face the next day. And whether it's in a conflict or whether it's front of repeated cyclones that have been exacerbated and strengthened by climate change, that answer is the same and is valid.
Vanessa Aliaga, pour reprendre les mots de Stephen.
Vanessa Aliaga, to pick up on the words used by Stephen Cornish, hope. How can you create hope in the minds of the Peruvian population and do more to improve their mental health?
So I think that one of the ways to do it is more awareness raising that isn't fatalistic. So not, I know I just said that it was like the Titanic, so I'm not the best example, but exactly the opposite of that. That with little actions, we can make a difference. Very positive messaging that is true, that is rooted in facts and figures. And I think also empowering communities, not just the most vulnerable, but kind of future leaders like Mateo. So empowering them to realize that governments respond to public pressure. It's in fact the only thing that works in the face of very strong economic and political interests, is kind of grassroots mobilization, civil society, using platforms, social media, and who's better at that than youth. So I think that, yes, it's very worrisome. Yes, it seems like we're all on the Titanic. But I think that by empowering people, by realizing that there's a lot that you can do on a micro scale, but if we all do it, it will make a pretty big difference. And I think messaging that goes in that line, it does a lot, I think. If Peru has done that, not quite. We haven't reached that proactive space yet. We're more trying to play catch up with the effects. But I think that it's not a leap. I think soon we'll have to go in that direction.
Stephen Cornish, je voulais ajouter quelque chose de très court. Il faut être très court parce qu'on est au...
Stephen Gomez, would you like to add something? Please be very brief.
Many of the most vulnerable countries have very underfunded on psychological and psychiatric care. And there is a workaround that can be done at a very low level. In our work, we're often training teachers and social workers to be able to carry out much of this baseline work and then just refer cases up in difficult situations. So I think there's a role for public health actors and many actors that would be in this room.
Alfonso Gomez, vous avez commencé.
Mr. Alfonso Gomez, you started, I will let you have the last word on mental health. How do you envisage taking care of the mental health of the people of Geneva? What should be done to improve people's mental health? Answer. The first thing is well-being. Feeling good and comfortable in one's city. And obviously, for people to feel good and well, you have to provide them with the right structures. Now, of course, you can say solutions exist. And you can tell people how we are going to manage to reach these solutions. As has been said previously, I don't know whether all the solutions that are being tried out will produce results. But we are convinced that there are solutions and that we will be able to achieve these solutions to climate change. But to implement them, we need a certain amount of things. For example, distribution of goods and property, and also the need to take more care of certain minorities. That's the most important message, creating the conditions for well-being, better sharing of wealth in society. That will be our conclusion. Thank you very much indeed, all of you, for having taken part in this panel.